y'all.
Hey everybody, welcome back to Chiro Coffee Chats. I'm Dr. Pete.
I'm Dr. Carla.
So this week we're going to talk about something which might be new information to you, and that is chiropractic care during pregnancy or for pregnant patients. Maybe you've heard of that, maybe you haven't. There's a couple things that we'll discuss, like our experiences dealing with patients. I'm going to say first off at the top that one of the best situations, if possible, is that somebody is under the care of a chiropractor before they get pregnant. Now, I know that doesn't always happen, but can you think of any reasons why that would be ideal?
Well, you want the body to be as mobile and as loose and flexible, joints moving as well as they can before getting pregnant. When things start changing, shifting, muscles start getting stretched, joints start getting stressed, you want the body to be moving as best it can before that so it can adapt to those changes while you are pregnant. Yeah,
absolutely. Because for some patients, they'll come in like they may be, let's say, 3 or 4 or 5 months into pregnancy, and they'll say, well, I had back pain, but it's gotten worse as my pregnancy's gone on, or I had headaches before, but now they're more intense or more frequent. And so if we start working with them at that time, I mean, it can definitely help, but it's a lot nicer if we would have had them before and got those problems kind of cleared up, got their body functioning, spine, hips, neck, everything moving pretty well before, they actually get pregnant. And then that's kind of an additional stressor. What do you think's, like, how would you describe the stressors of pregnancy on the body? There's one in particular I'm thinking of, but let me see what you're going to say here.
The stressors? Well, there's not only just like the emotional component of it too. It's a big change. You see your body change. There's a lot going on, but also the biomechanical changes of it as well. Your body's growing, adapting, like pretty much not just your uterus is growing. There's a bunch of different stressors taking place. Changes in your gait, changes in the way you move, sleep, everything. So
that's what I was going to mention was that so if you've studied even physics or maybe some biology, you'll be familiar with the concept of center of mass or center of gravity. So in a human being, we like to imagine that would be a line going through like the sort of the middle of the skull and the shoulder and then the hip and then down to the knee and the ankle. And when this baby grows in front of you and the mass of that increases, your center of gravity goes to the front of the body if we're looking at a body from the side, which then is going to put, we may have like for instance, low back muscles are starting to have to work posturally a little bit more and a little bit harder to keep that person upright, and that can exacerbate, low back issues as an example of, some of the physical stressors of pregnancy. Now, you mentioned, or you're going to talk a little bit about the Webster technique. So for our viewers that aren't familiar with that, why don't you just introduce that, Dr. Carla?
So Webster's technique is something certain chiropractors are trained in to help pregnant patients as they change through pregnancy. So what it does is it assesses the pelvis and the round ligament. So the round ligament is what attaches the uterus to the actual pelvis itself, the bony structures of the pelvis. And during pregnancy, as the uterus grows, the round ligament becomes stretched on both sides. There's one on either side. And what this does, if the pelvis especially is restricted, it can put altered stresses on this round ligament. So what Webster's technique does is assess not only the pelvis, but also the round ligament to kind of aid in, I guess, stretching.
Well, I was going to say, so the concept of and I believe it's even referred to in literature, the concept of in utero constraint. So maybe as that uterus is growing, there's more tension on one side.
Right.
Now, maybe that might not be of consequence in every pregnancy, but for some, it might as the baby gets bigger, or let's say there's twins or triplets, like that. You want all the space in there possible so the baby can move and then eventually get into the right position for delivery. So that's really another key thing is that. And a lot of times, we will work in conjunction with midwives, let's say. So they're looking at one of the later ultrasounds during pregnancy, seeing the position of the baby, and hopefully that baby can get into the right position for an ideal or the easiest delivery possible.
Right.
Doesn't always go that way, but that is one of the hopes with keeping abdomen and pelvis functioning well during pregnancy.
That's exactly it. It looks at the correlation between pelvic function and rattling ligament strain and constriction. So kind of go hand in hand there, and it helps really relieve the tension.
Awesome. I was just going to mention too, from a clinical practice perspective. So a lot of our, like my regular patients that I might see for care, they might come once a week, once every 2 weeks, once a month. And that is sort of like, we might call that maintenance care for them. When they get pregnant and into particularly the third trimester, a lot of times that's when they're starting to get, even though they might have been doing really well, they might start to get uncomfortable at that point with low back, with hips, with neck, with headaches. And that's usually a time where we might up the frequency of care. So a lot of times in that last month or 2 or 3, we might see the patients twice a week in the office. And for a lot of them, they really appreciate that because that helps those last 2 months go smoothly. They feel, you know, they're carrying this big baby around and they can just feel more comfortable. And, you know, actually, I'm just thinking of it now, sleep is a huge one.
Oh,
so
for sure.
Positioning with a large abdomen with baby or babies, right? To be comfortable to sleep is, you know, would be huge. So for a lot of them, they really appreciate the extra care at the end of pregnancy. We can also talk about post-pregnancy. So a lot of women today do end up getting C-sections. And after the C-sections, they may, you know, there's a recovery period, right? There's an incision. But some of our patients, I've had patients that, you know, they still want to be adjusted, you know, their neck or their mid-back, they're still having pain there or headaches. They're now carrying and breastfeeding, which puts strain on the upper back region.
It's not over once you get back.
It's just beginning. Just beginning, yeah. So, and people might think, well, you know, you had the incision, they can't be adjusted. But we have other alternatives. So what would they be?
You can do activator, you can do really light drops on the patient, just really gentle techniques instead of the high velocity adjustments that, you know, you see in videos with the crack and everything. Not necessarily that. It's a lot more gentle as they transition out of kind of the surgical post-op procedure. And
even some I've done house calls after, and we can adjust the neck in a seated position in a chair. So that can give them relief from neck pain, headaches, but they don't have to lie down on that incision area where they've had that, you know, the trauma of the C-section. So that's a little bit of information for you guys. Anything to add, Dr. Carla?
Well, I think a lot of the times too, women assume that, you know, I'm pregnant, of course I'm going to be in pain. There's nothing that anyone can do. I'm, you know, 8 months pregnant. What could someone possibly do? I'm supposed to be in pain right now, right? I'm carrying this big baby around, but it's great to educate people and say that we can help. You know, it doesn't have to be this painful last 3 months of pregnancy. Like,
that's a great point because I'm glad you brought that up because I'm sure you have, and I've had many patients that they've been really comfortable pretty much throughout the pregnancy, and chiropractic has a lot to do with their ability to get through that in a comfortable way. And of course, as mentioned, if you're not following us on Instagram, we did a post earlier this week about safety and efficacy of chiropractic care in pregnancy for musculoskeletal things, back pain, neck pain, headaches, etc. So it's people might be wondering, is it safe? And the answer is yes. And again, the chiropractors, we are using techniques that that person's body can handle that are going to work for them. So cool.
If you're moving and functioning properly before pregnancy, then you can move and function properly during pregnancy too. Hopefully reduce your pain as much as possible. So
well said. Well said, Dr. Carla. Excellent. Wow. Hope you guys found that informative, and thanks for watching. Please give us a like and please subscribe, and we will see you with another video next week.